Hi, Namaste. So today's topic will be about disorders. So we have discussed a lot, not many sessions of psychology, based on the syllabus, and in between, on demand of students, we are releasing the videos about psychological disorders too. I have released already a schizophrenic disorder, so we got a very good response from the students. And now the second disorder which I am going to discuss is today is about learning disability. Okay, so learning disability is having problem in learning. It is a childhood disorder. Okay, a child having problem in learning, or it may be, if it continued, even adults may be having problem in the learning issues. Okay, so learning disability is having problem in learning. So learning means what and all things comes. So under learning there will be reading, writing, calculation, and some of the motor activities. Okay, so the child having problem in reading, writing, calculation, and motor activities is considered as learning disability. Okay, and even there are specific learning disabilities in which he has only problem in reading. Okay, so he has only problem in writing. Okay, so that is called specific learning disability. If he has problem in all the areas of learning, then it is learning disability. Okay, the child having a problem in writing, then it is called as dysgraphia. The child having problem in reading is called as dyslexia. Child having problem with calculation is dyscalculia. The child having problem with motor activities is dyspraxia. Okay, so these are the four major types of learning disability. Okay, now we'll see way of diagnosis and at what age we can diagnose the child is having LD. We can call it as LD, that is learning disability. So for diagnosis, the child should undergo some IQ test or performance test, okay, which will be conducted by the clinical psychologist, by the psychiatrist in the hospital setup. And with that test, whatever the score we get, whatever the performance score we get, on basis of that we can find out whether the child is LD or whether the child is normal or whether child has any other childhood disorders. Okay, at what age can we diagnosis? So the age of this diagnosis can be done once the child starts learning continuously, once the child starts going to the school continuously. Okay, maybe at young age at home we will be helping the child to learn alphabets or few things. At times he may not show attention, so we will think it may be like the child is not feeling interested, the child may be wanted to play, that's why he is not showing attention, that's why he has written wrong. We will not think that it may be some issue. But once the child starts learning continuously, consistent learning starts, that time we can identify whether the child is having LD, whether the child is normal. Okay, so few symptoms, the child who is having a learning disability, we can see these symptoms among that particular child. That is difficulty in reading and writing. Okay, as I said before, only reading writing problem will be there, and there will be problem in calculation. Calculating will be difficult for them. Difficulty in remembering, so memorizing the things will be difficult for them. Even the child is reading regularly, but it can't remember whatever it studied. And having problem in paying attention to the studies, can't sit at one place and pay attention to the studies. And being disorganized. Okay, unable to organize his studies, unable to organize his work properly. Okay, and difficulty in following the instruction, whatever the instruction given by the teachers, instruction given by the parents, the child finds difficult to follow it. If you are given more than one or two instructions, the child will get confused, what I have to do, which instruction I have to do, and what was the first instruction, what was the last instruction, so you get confused. And even lack of coordination. Okay, he cannot coordinate with the concepts, whatever he is thinking he can't write, he can't reproduce it, whatever he is saying he is not writing it, whatever he is writing and he is not saying it. So there is incoordination among the things like the writing and reading or saying, there is no proper coordination. Okay, so all these are the general symptoms of a child having learning disability. Now we'll see the treatment and therapy. So in treatment and therapy, major treatment is individualized education program, and then extra help to the child and therapeutic programs. IEP is something like they will consider each child, and it is true that each child, each person is a different person, each individual is different. So here they will make an individual educational plan, okay, educational program based on the case history of a child, based on the IQ of a child, based on the understanding level of the child. Few targets are set, few methods of teaching has been set, and according to that the child will be taught, okay. Then extra help to the child. So you may feel like for my first child I used to say only once he used to understand, but this child needs lot many times. Yes, it needs, because he has a problem. So that's why we should give extra help. And parents, being a parents and being a teachers of these kind of kids, we should have a extra patience also, okay, to repeat for them, to help them to study. And then therapeutic programs where will teach them with the occupational therapy, where sometimes they may need speech therapy, sometimes they may need other kind of therapies also. So based on the demand of a child, based on the disability of the child, we should plan for a therapy. And even you have watched a movie Tare Zameen Par, where the child was having a problem with learning, okay, and the in the movie the hero had helped him so much in the different ways. The teacher had helped him in a different ways of learning, so that the child is able to learn things properly, okay. So they need more of activity based learning rather than just what I can say, just teaching, just a theory kind of teaching will not work with them, will not help them much, because their way of thinking, their level of imagination will be different from a normal kids. They may be very good at sports, they may be very good at culturals. Few parents say he is interested only in that, he is not interested in learning, that's why he is not studying. No, not like that. He may be having some issues. We should not just generalize the things. He can be good at sports, he can be good at culturals, but having issues in learning. So, being a parents, being a teachers, we should help them to come out of that. Okay. So, and don't worry, even though the kid is having LD, learning disability, and it is decided by the psychiatrist. Okay. Don't, a parent sitting at a home having a child having some issues in the learning, don't decide yourself that child is having LD. Okay, child is having some issues. You go to psychiatrist, conduct the test, then with the result, with the psychiatrist opinion, you should come to know that the child is having LD or not. If the child is proved to be having LD, even that is proved that he is having LD, that's okay. Don't worry. The parent should not get worried, but not being worried, you should help the child to overcome it. Okay, and he will be fine. And you can search in a Google. So there are many person with LD had achieved so much. Okay, there are many celebrities, there are many achievers who had LD and they try to overcome it. Okay, they have overcome it and they achieved, they are leading a very good normal life. Okay, so even a person with the LD can lead a very normal life. So with this I'm ending up this session, and if you find our videos helpful and informative, please subscribe to our channel very soon. Thank you so much.